Good evening and welcome to Straight Talk. This is Eugene Chan, and tonight our guest is Professor the Honourable Arthur Lee. Welcome, Arthur.
Thank you very much, Eugene.
I'm sure Arthur is well known to all of us, and I'm sure they would agree you would be the most appropriate person to talk to us about the recent proposal from the government, so that we are trying to recruit doctors back to Hong Kong because of shortage problems. And as you know, Professor Lee is an Executive Council member. He's also the chairman of the Council of the University of Hong Kong. In the past, he was the Secretary for Education and Manpower, and he is also the Emeritus Professor of Surgery at the Chinese University of Hong Kong, where he was also a Vice Chancellor as well as the Dean of the Medical School. And Arthur is also overseas trained, and he had his training in the UK at Cambridge, as well as Harvard in the United States. So a very complete and full education that you had, Arthur.
Yes, thank you very much, Eugene.
And 2 weeks ago, we talked about this same topic and about the government proposal to trying to attract non-locally trained doctors back to Hong Kong. And I had so many calls and many feedback in the news about this topic. So that's the reason why we want to do it one more time to look at it from a different perspective. Right. So, Arthur, I mean, before we start, maybe we will look at the proposal again. The proposal is, in order for us to bring the non-locally trained doctors back to Hong Kong, they have to fulfill 3 criteria. Number 1, they must be permanent residents of Hong Kong.
Indeed.
They must undergo the education at an approved medical university, right, as well as having the registration at that place of training. Yep. Then they have to be back employed full-time back in Hong Kong in a public service for a matter of 5 years. Those are the 3 main criteria. Right. So what are your views? Do you think that we will attract enough doctors back to Hong Kong?
Well, first of all, there is no doubt a great shortage of doctors in Hong Kong. At the moment, there's about 15,000 doctors in Hong Kong, which means that there are only 2 doctors per 1,000 population. That is a gross inadequacy. Right. But there is even worse situation is in the public doctors, public hospitals. 45% of these 15,000 doctors work in the public hospitals, and they look after 85% of our population. So in other words, there are about 7 doctors per 1,000 in the private sectors, but less than 1 per 1,000 in the public sector. So there's no doubt that there is a great shortage of doctors. This is also seen in the context of waiting list. In order to see a specialist at the public hospital doctors, you can wait up to 3 years.
Wow, that's a very long time, isn't it?
That's a very long time. Even, I mean, you know, if you're in pain, you've got to wait for 3 years to have your hip replaced. That's not actually 3 years to have your hip replaced. That's 3 years before you see a specialist.
Wow, so
and then you have to make an appointment to have your operation, and there's another long wait. Right. So there's no doubt that this is a situation. Now, before 1997, we allow Commonwealth doctors to register in Hong Kong and practice in Hong Kong. And roughly each year is about 500 odd doctors come in from the Commonwealth countries to Hong Kong. And of these 500 odd, about 200 odd are local Hong Kong people who studied overseas and come back to Hong Kong.
Just like myself and
just like ourselves. So, but because of 1997, there was a great fear that if we allow Commonwealth doctors to come to Hong Kong, we would also allow Chinese trained or doctors trained in China to come down to Hong Kong. And because of that, the medical profession decided that we will remove recognition of all doctors trained outside Hong Kong. Right? So since 1997, we have this great shortage every year, because we lost this 500 doctors every year coming back. Right? Yeah. Now this is a very small step that the government has put forward, meaning that only Hong Kong residents can come to practice in Hong Kong. These are Hong Kong people. These are our own people.
Just like what we did before.
Yeah, just like what we did before. Someone else had the expense to train them, right? We don't have to spend a penny on them, and we welcome them back, right? Now, the second important thing is there is an examination to allow people to come back. And one of the contention is that these people come back will not need to take this exam.
Right.
Right. Now, if you look at the examination, there are three parts to this examination. The first part is medical knowledge, a multiple choice, and roughly about 30% pass that.
Right.
Second part is the English language. About 90% of people pass that. Then the third part is about clinical practice, and about 40% pass that. But if you take it from day one all the way through 3 stages, roughly only about 10%, 11% actually get through, all the way through. Right. So in other words, this is a very tough exam, right? With a very high failure rate.
Or low passing rate.
Or low pass rate, right?
Professor,
now, if you say this is such a good exam, why don't that keeps up our standard? Then why not use this exam for all the practicing doctors in Hong Kong? Those who are every 5 years, everyone takes this exam. Right. But I'm sure no one wants that.
No, I'm sure no.
No doctor will want that, right? So when we come back to this, is that we do need doctors. Bringing Hong Kong trained doctors back to Hong Kong will not solve our problem, right? But it's a small step towards relieving the shortage of doctors.
Professor, I was going to ask you, if it's going to be a small step, I had looked at some figures. Like this year, we are short of 700 doctors in the system. If you look at 2000, and then 10 years time, 850, and then 20 years time, we are 1,000 doctors. Yeah. How are we going to attract so many doctors going to fill this void? Although it's a small step, but this is at least, a start, because I understand the local medical schools actually has increased our intake and output over 100%. So what are we going to do?
Well, there are 2 things we could do. First of all, we could have a 3rd medical school.
Right.
But to have a 3rd medical school, it will take at least 10 years before they can turn out the first graduates.
Yes.
Right. So this is a long-term thing. But the second important thing is that both the Chinese University and Hong Kong University are planning medical schools in Shenzhen.
Right.
So presumably they would be having the same curriculum as the medical schools in Hong Kong. So these doctors who are trained there are trained by our university. Would they be allowed to come back and work in Hong Kong? I don't know, but certainly it is a possibility. The second obstacle in bringing doctors into Hong Kong, besides the examination having a high failure rate, is also the requirement that they have to spend a year or 6 months of internship. Right? In other words, if I, as a surgeon, want to come back and I pass all the exams, I have to spend my internship not in the specialty of my choice. In other words, as a surgeon, I might get to do psychiatry.
Right.
Right?
So that means it's not fully...
That's just crazy, right?
I think we're wasting a lot of resources, aren't we?
Yeah, wasting manpower, wasting resources. Or if I want to be a psychiatrist, I might get sent to be a pediatrician, which is totally ridiculous, right? And these are actually obstacles to stop people coming to Hong Kong to practice.
Yes.
And this is not right.
Yeah, when you're talking about it's a small step, I read in the news that we're aiming to take 200 doctors per year.
Yeah.
Do you think that is a realistic figure? Because I'm sure people who have established overseas, they have many things to consider, like for the family, the kids' education, the high cost living in Hong Kong with the housing that is so expensive in Hong Kong. That may not be a very good, sort of a push factor for them to come back. Do we have a plan B? What happens if we don't get the 200 doctors to come back to help us at least a small step?
Well, if we don't get the required, I think even with this plan in place, we still would be short of doctors.
Right.
There's no question about it. But it's a small step to relieve the shortage, but it won't relieve the shortage altogether, right? So if you say what happens next, I think we would have to take a look at the situation and say, should we allow, once we recognize the overseas medical schools, should we allow those graduates from those medical schools practice in Hong Kong, like before in the Commonwealth countries? Right. Yeah, but these are long-term planning.
Yes. Maybe before the break, I want to ask you about the Special Registration Committee, because there will be a committee set up to look at the
approved medical schools.
They're hoping to get 100. Yeah. The makeup are they're going to have the Council of the Medical Council, the Chairman of the Medical Council, the president of the Hong Kong Academy of Medicine, the director of health, the chief executive of the hospital authority, the deans of the Hong Kong U and CUHK, and there are not more than 4 members appointed by the chief executive. Do you think this makeup will be able to help us to find the good 100 schools?
I'm sure, because the 4 members appointed by the chief executive are likely to be members of the medical council.
Right.
So the medical council is in charge of the registration of all doctors in Hong Kong, so they know what the standard should be. The deans of the medical school, the president of the academy, are international figures.
Yeah,
so they know
I've
what the
also
standard
noticed
overseas are.
They haven't put in any representatives from the medical profession for whatever reason. Do you think they have to invite
They have.
I mean, I'm talking about the Medical Association, Hong Kong MA maybe, Doctors Union maybe. Do we need them?
Well, of course, because they are in the medical council.
Okay.
Right? So the medical council is represented.
Right.
And don't forget, there are 14 members out of the 32 members are from Hong Kong Medical Association.
Okay. That's good. Right. Maybe we have a break. Don't go away. Welcome back. We've been talking tonight about the doctor shortage problem in Hong Kong and the government proposal to attract more non-locally trained doctors. With us is Professor Arthur Lee. Arthur, before the break, we were talking about the Special Registration Committee and we talked about whether it's properly represented. In your opinion, you are confident they will help us to select the 100-odd institutions. Yeah. But you hear some of the comments from locally from our, I mean, we had CH Leung the other day. He commented that because the Special Registration Committee doesn't have the power to go inspect the other institutions, or I mean, they don't have the right to know the details of the curriculum, and he's a bit worried. And some may say that this is a very self-protection sort of approach. What is your view on that?
Well, I think if you don't want to increase the number of doctors in Hong Kong, that you can think of all sorts of reasons.
Right.
But the main reason of why you don't want to, I think, is basically a very selfish reason. Right. I hate to say this, but only a small number of doctors in Hong Kong behave in such a way. I think the vast majority of Hong Kong doctors are very hardworking and think about the patient. As I said, you now have to wait 3 years to see a specialist. That's not right for a place like Hong Kong, which is a wealthy place. We have resources, we have very good hospital, we have a very high standard of care, and yet our waiting list is so long. So something has to be done.
Yes. Arthur, you mentioned earlier in the first part, you mentioned about the history of what actually happened with 997. Yeah. Because we're doing a handover, we're trying to make sure Hong Kong has the standard we want. There's a reason why we have universal sort of examination sort of approach. Yeah. Time has gone by for 25 years now. Yeah. And when the Special Registration Committee can look at the other medical schools curriculum, do you think the mainland ones can be looked at? I mean, some of the medical schools can be very high standard over there.
Yeah, I think the important thing is to look at first of all, the language of instructions.
Right.
Right. Yeah, in Hong Kong, both our medical schools, our language of instruction is English. So if they don't use English, I think that rules them out straight away.
Yeah.
Right. And I don't think there are many medical schools in China that actually uses English.
Right. Okay.
As a teaching medium. Secondly, I think with as I said, the deans of the 2 medical schools, both of whom are internationally recognized specialists, they do have a lot of contact overseas. So they do know what the standards are with the overseas medical schools.
Right.
So I don't worry at all of their competence in deciding what is good medical school and what are average or below average medical schools.
So with this new proposal, when it comes into effect, that means our local students, they have an extra option to choose to go to different schools in the world and not having to worry, not be able to practice back in Hong Kong. And we, as you said earlier, it costs us so little.
Yep.
to have a full-fledged medical doctor back to Hong Kong to serve.
Yes, it's a win-win situation.
Right. Okay. Right. So I think we have talked enough about that, the proposal, and let's talk about something more imminent. It has been said that the hospital authority has quite a high attrition rate. Yes. That the doctors are not staying, especially the more senior doctors are leaving. Yeah. I'm sure there are multifactorial reasons for a decision to move on or to stay. Do you think the Hong Kong government or the bureau or the hospital authority, are we doing enough to retain our talents within the system?
Well, first of all, the Hong Kong government actually spent a vast amount of money into our hospital system.
Right.
There's no question about it. The important question is that money well spent, right? And if you ask our frontline doctors, the majority of them, the vast majority of them, would not have a good word to say about the hospital authority. Right? It is something that is accepted. No one likes the hospital authority who works within the hospital authority, and you have to ask why.
Right.
The simple reason is that it is very, very bureaucratic. They have meetings, they have committees, and senior doctors, instead of spending their time looking after patients, have to go to HA headquarters to have committee meetings, time, and fill in forms and so on. So this is very demoralizing because they're doing what they're not trained to do, right? So that's the first thing. Second thing is there are a lot of managers within the hospital authority, right? There are as many managers as doctors, right? Then you say, well, what's the purpose of that, right? Do we need so many doctors?
So when you say that, do we need a major overhaul of the hospital authority?
I think we do. I think we do need to look into the whole working of the hospital authority, whether we need so many layers of bureaucracy in order to get things done.
Because this will, if everything is solved, we will, I think our shortage probably will be much less.
Well, it will create a much happier atmosphere within the hospitals. Doctors will be, at the moment, I think a lot of doctors do not find fulfillment in their job. They are frustrated. Senior doctors are frustrated because they can't do what they want to do, right? They have to fill in forms, they have to sit in committee meetings instead of looking after patients, which is what they want to do.
Do you anticipate the government or the hospital authority is going to change that in the immediate future?
I don't think they'll do it quickly, but I think this is something that needs to be done.
Right.
And it's a matter of time before they realize that something needs to be done.
So in the meantime, I'm sure we've got some very good specialists that have been serving our public servants for many years that could be retiring. Is there anything we can do to sort of ask them to come back for the time being to help us with some sessions?
I certainly think so. Certainly, I think there is a scope for private-public partnership, the PPP.
Right.
So that our private doctors could come in and help out in the hospitals, and I think many of them would be happy to do so. And I think these are options that needs to be explored. Right.
Arthur, I'm going to ask you a very direct question. I didn't plan for that, but I felt it coming from my mind. When you said earlier, you mentioned the possibility of the local profession being maybe a bit selfish. Do you think that by having more and more overseas trained doctors back to Hong Kong, is this going to affect the livelihood or the career prospect for the local doctors? I'm sure they would be worrying about that, but from you've been overseas, you've been the Vice Chancellor of Chinese University, you look at Hong Kong University, you look at Hong Kong as a whole. What do you think?
Well, first of all, I think competition is a very good thing, right? If you are worried about competition, then you would only go downhill.
Right.
So the greater the competition, the better it is. So I should certainly welcome local doctors trained overseas to come back to Hong Kong. I have no problem about that. But no doubt they would be a competitive force in terms of jobs, in terms of training, and so on. And I can understand many of our junior doctors are worried about it. But they should have confidence because they are trained locally. And they're trained by two very, very excellent medical schools. So they need to really worry that much. So
you have a really reassuring messages to our younger graduates. They have nothing to be concerned.
No, they shouldn't be worried.
Right. In the last part of the show, I want to bring up some comments that I hear from my colleagues. Every time when the government come with a proposal, the community will always think of something different to help, which I appreciate. I had a lot of phone calls. And for example, Dr. John Wong and Dr. Chow Pak-jin has suggested that whatever we're doing is fine, but they need to do a good public and private cooperation that you mentioned. That has been talked about for a long time. Do you think do you think the government has the determination to do that?
Well, I think you have to ask the government that question. But basically, you can see with Dr. Chow Pak-jin's proposal for cataract surgery,
yes,
the waiting list was 5 years. But when they bring in the private doctors, they now reduce the waiting list down to 2 years, right? So it is helpful. There's no question about it. And I think it should be explored.
Right. And also Dr. Paul Scher saying that we should develop more on the primary and family medicine instead of developing more and more specialists.
Yeah.
That's what happened in the UK.
Yeah.
Do you agree?
I totally agree. I think if we have a strong primary healthcare system, this will relieve the people going to public doctors, going to public hospitals. There's no doubt about it, because many of the conditions could easily be handled by family doctors.
You know, Arthur, I mean, when we live overseas, you know that when you want to see a specialist, you've got to go through the local GPs or the family physician to refer. But in Hong Kong, they can go direct.
Yeah.
Do you think we have to do something about that? Because all the specialists, all the time, we're all taken up by trivial cases.
Yeah.
Is there anything that we can do to?
Well, I mean, if we have a strong family medicine system in Hong Kong, this will take care of it, certainly, because many of these conditions could easily be treated and handled by good family doctors.
Thank you, Arthur, for sharing your thoughts on this very important aspect that I'm sure all our audience are concerned, and that's the reason why we're doing the second show within 2 weeks. And we do hope that whatever we have discussed tonight will let our audience an even better understanding of the government's proposal, and we all look forward to seeing some relief to our doctor shortage issue in Hong Kong. So have a good week, and we'll see you next time. Good night.
Thank you.